Are you or someone you know terrified of snakes? You're not alone. Ophidiophobia, or the fear of snakes, is one of the most common phobias worldwide. But why do so many of us feel this way, and what can we do about it? In today's video, we'll explore everything you need to know about ophidiophobia and how to overcome it. Let's dive in. Section 1. What is ophidiophobia? Ophidiophobia is the intense and irrational fear of snakes. While it's normal for people to be cautious around snakes, this phobia goes beyond simple caution. Individuals with ophidiophobia experience extreme anxiety when they encounter a snake or even think about one. Studies suggest that 1 in 3 people have some form of fear of snakes, ranging from mild discomfort to full-blown phobia. It's one of the most common animal phobias worldwide, especially in areas where snakes are part of the local wildlife. Humans may be biologically predisposed to fear snakes as part of an evolutionary survival mechanism. Throughout history, venomous snakes posed a significant threat, so an instinctive fear of them could have been beneficial for survival. Section 2. What causes ophidiophobia? Traumatic experiences. Personal encounters. One of the most common causes of ophidiophobia is a negative or traumatic encounter with a snake. This could be a bite or a near-miss situation that leads to heightened fear. Even witnessing someone else having a traumatic experience with a snake can be enough to trigger the phobia. Example: a child who is bitten by a snake may develop an intense fear of snakes that lasts into adulthood. Learned behavior. Observing others, people, especially children, can develop fears by observing others react with fear to snakes. This could be a parent, sibling, or even seeing others react fearfully in movies or media. Example: if a child grows up in a family where others are afraid of snakes, they may learn to associate snakes with fear and danger. Cultural and media influence. Movies and TV shows. Snakes are often depicted as dangerous, evil creatures in popular media, like movies, cartoons, and even news reports. This can perpetuate an exaggerated fear of snakes, especially in children, who may not yet be able to differentiate between fiction and reality. Cultural myths. In some cultures, snakes are linked to superstitions, danger, or evil, which can intensify the fear. Evolutionary psychology. There's an evolutionary theory that suggests humans may have evolved to fear snakes because they were historically a significant threat to survival. The instinctive fear could have helped early humans stay alert and avoid potentially deadly encounters with venomous snakes. Section 3. Symptoms of ophidiophobia. Physical symptoms. People with ophidiophobia often experience physical reactions when they encounter a snake or even think about one. These symptoms may include rapid heartbeat or palpitations, shortness of breath or difficulty breathing, nausea or dizziness, sweating or trembling, tightness in the chest or throat. Fight or flight response. These symptoms are the body's natural fight or flight response, activated by the perception of danger, even if the snake is not actually threatening. Emotional symptoms. Intense fear. Even the thought or image of a snake can cause overwhelming feelings of fear, panic, or dread. Avoidance. People with ophidiophobia will go out of their way to avoid situations where they might encounter a snake, whether in nature, at a zoo, or even on TV. Behavioral symptoms. Avoidance behavior. A person with ophidiophobia might avoid hiking, camping, or walking in areas where snakes could be present. They may also avoid certain animals, such as reptiles, or avoid places with snake-related themes. Escaping. In extreme cases, even seeing a snake on a TV show, movie, or in a picture can cause them to physically leave the area, or avoid watching media where snakes are present. Section 4. How to overcome ophidiophobia. Education and awareness. Learning about snakes. One of the first steps to overcoming any phobia is education. Understanding snake behavior, their role in ecosystems, and knowing that most snakes are not dangerous can help reduce irrational fear. Dispelling myths. It's important to address common misconceptions, such as all snakes being venomous or dangerous. Most snakes are harmless and play a crucial role in controlling pests and maintaining the balance of nature. Gradual exposure therapy. This form of therapy involves gradually exposing the individual to the object of their fear, in this case, snakes, in a controlled and safe manner. This helps desensitize the individual to the fear. Step 1. Start by looking at pictures or videos of snakes from a distance. Step 2. Visit a zoo or sanctuary with safe, enclosed snake exhibits. Step 3. Under the supervision of a professional, hold or touch a snake. For those with more severe phobias, this step may come later. Cognitive behavioral therapy, CBT. CBT helps individuals identify and change negative thought patterns related to their fear. For ophidiophobia, this means addressing irrational thoughts like, "All snakes are dangerous," or "I'll die if I see a snake." Through CBT, people can replace these thoughts with more rational, calm perspectives. Relaxation techniques. Techniques like deep breathing, meditation, and progressive muscle relaxation can help manage the anxiety that comes with ophidiophobia. Learning how to calm the body's natural fight or flight response is essential for overcoming fear. Visualization. Some people find it helpful to use visualization techniques, imagining themselves calm and in control while interacting with a snake or observing one safely. Medication. For severe cases. In cases where phobia symptoms are severe and interfere with daily life, medication may be prescribed. Anti-anxiety medications, beta blockers, or even antidepressants can be used to reduce the physical and emotional symptoms of the phobia. Section 5. Why it's important to overcome ophidiophobia. Impact on life. Fear of snakes can severely limit daily activities, such as hiking, camping, or even visiting places like zoos or botanical gardens. Overcoming this fear can help individuals engage in these activities more fully. Personal growth. Conquering any phobia can be a huge boost to confidence and self-esteem. Facing fears head-on empowers individuals and improves their overall mental health. Appreciation of nature. Overcoming ophidiophobia can lead to a greater appreciation of wildlife and nature. Understanding the importance of snakes and maintaining ecological balance is a great way to respect and coexist with these creatures. Thank you for watching. We hope this video helped you understand ophidiophobia better and gave you some insight into how to manage or overcome this fear. If you or someone you know struggles with ophidiophobia, remember that you're not alone, and there are many effective treatments available. If this video was helpful, don't forget to like, share, and subscribe. Let us know in the comments if you've had any experiences with ophidiophobia or if you have questions. See you in the next video.